Hi everyone, welcome to PharmaGrid. So let's continue with the question discussion series. Question number 41. All of the following drugs are believed to undergo significant first-pass hepatic biotransformation except the options are lidocaine, morphine, nitroglycerin, phenytoin, propranolol. So in the question they have asked us to find out the drug which does not undergo first pass metabolism. So here the correct answer is option D, that is phenytoin. Only 5% of phenytoin is metabolized in the liver. Most of the drug is excreted unchanged. So examples for drugs showing high first pass metabolism include nitrates, for example nitroglycerin, then hydrocortisone, lignocaine, propranolol, salbutamol and morphine. Which of the following factors affect the distribution of a drug? The options are lipid solubility, plasma protein binding, polarity, molecular size, all of the above. So here the correct answer is option E, that is all of these factors, that is lipid solubility, plasma protein binding, polarity, molecular size, all these factors affect the distribution of a drug. Next question. The term prodrug refers to a. The options are chemical substance that is part of the synthesis procedure in preparing a drug, compound that liberates an active drug in the body, compound that may be therapeutically active but is still under clinical trials, drug that has only prophylactic activity in the body, drug that is classified as being probably effective. So in the question they have asked us the definition of a prodrug or what is a prodrug. So here the correct answer is option B. It is a compound that liberates an active drug in the body. These are chemical modifications of biologically active drugs and are not active themselves. Okay, so these prodrugs are inactive themselves. However, the active form of the drug, that is the metabolite, is liberated in the body by biotransformation or metabolism. Prodrugs may possess better water solubility, be more stable, have a less objectionable taste, or give higher blood levels than the parent compound. Moving on to the next question. Drugs that are poorly lipid soluble, which means water soluble, then polar or extensively ionized at the pH of blood generally. The options are penetrate the central nervous system very slowly and may be eliminated from the body before a significant concentration in the CNS is reached. Next option is penetrate the CNS very slowly but are centrally active in much lower concentration. Then achieve adequate CNS concentrations only if given IV. Must be metabolized to a more polar form before they can gain access to the CNS. And the last option is can gain access to the CNS if other drugs are used to modify blood pH. Okay, so here the correct answer is option A. That means the drugs that are water soluble. Okay, poorly lipid soluble or polar means drugs that are water soluble or extensively ionized at the pH of the blood generally penetrate the CNS very slowly, because we know that the CNS, the barrier is made up of lipids. Okay, the blood-brain barrier is made up of lipid membrane. So these drugs will penetrate the CNS very slowly and may be eliminated from the body before a significant concentration in the CNS is reached. Okay, that is the blood-brain barrier appears to behave as a lipoid membrane toward foreign compounds. The rate of entry of a drug can often be correlated with its oil-water partition coefficient and degree of ionization at the plasma pH. Only lipid soluble drugs, okay, lipid soluble or non-polar and unionized drugs can easily penetrate into the CNS. The volume of distribution of a particular drug will be. The options are greater for drugs that concentrate in tissues rather than in plasma, greater for drugs that concentrate in plasma rather than in tissues, independent of tissue concentration, independent of plasma concentration, approximately the same for all drugs in a given individual. So the question they have asked us about the relationship between the volume of distribution and the plasma protein binding. Here the correct answer is option A. Okay, so this volume of distribution will be greater for drugs that concentrate in tissues rather than in plasma. Following a given dose of a drug, the greater its concentration in various tissue compartments, the smaller its concentration in plasma. So we can summarize the relationship between plasma protein binding and volume of distribution as, in the first case, if the drug is extensively bound to plasma proteins, which means there will be high plasma drug concentration. Okay, that is the drug concentration will be more in the blood or the plasma, then there will be low volume of distribution. Okay, and suppose if the drug is sequestered or concentrated more in the tissues, the plasma concentration of the drug will be low and there will be high volume of distribution. Next one, if the rate of elimination of a drug is reduced because of impaired renal function, the effect on the drug half-life and the time required to reach the steady state plasma levels, that is the steady state concentrations which is represented as CSS, will. Okay, so what will happen to the CSS and half-life in a patient having impaired renal function? So the options are both will increase, both decrease. Next option is be an increase in half-life and a decrease in the time to reach CSS, that is a steady state plasma concentration. Next option is be a decrease in half-life but an increase in the time to reach CSS. And last option is negligible. Here the correct answer is option A, that is both will increase. If the biological half-life of a drug increases in patients with impaired renal function, the time required to reach the steady state plasma levels will also be increased. This time factor is only dependent on the biological half-life of a given drug in a given individual. Question number 47. A knowledge of volume of distribution for a given drug is useful because it allows us to. The options are estimate the elimination rate constant, determine the biological half-life, calculate a reasonable loading dose, determine the best dosing interval, determine the peak plasma concentration. Here the correct answer is option C. Volume of distribution is useful because it allows us to calculate a reasonable loading dose. Because the volume of distribution is a parameter that allows accountability for all of the drug in the body, it can be used to calculate the loading dose that would rapidly result in a desired plasma concentration. The metabolism of drugs generally results in. The options are less acidic compounds, more acidic compounds, compounds having a higher oil-water partition coefficient, more polar compounds, compounds with lower aqueous solubility. So here the correct answer is option D, that is more polar compounds. Drug metabolites are usually more polar and less lipid soluble than the parent compound. Next one, lidocaine hydrochloride is not administered orally because it is. The options are ineffective by this route, too acidic, too toxic by this route, a cause of arrhythmias, unstable. So here the correct answer is option A, that is lidocaine hydrochloride is not administered orally because it is ineffective by this route. Lidocaine is a drug which undergoes significant first pass metabolism. Oral doses are metabolized by the liver before reaching the systemic circulation. Question number 50. The biological half-life of a drug that is eliminated by first-order kinetics is represented mathematically by dash, where k is the first-order rate constant for elimination. The options are 1 by k, log k, 0.693 by k, 2.303 by k, peak serum concentration by 2k. Here the correct answer is option C, that is the biological half-life of a drug that is eliminated by first-order kinetics is represented mathematically by 0.693 by k. Okay, so we have completed today's question discussion series. If you have any comments, you can share. You can share your valuable comments in the comment section. And if you find my channel useful, please like, share and subscribe. Thank you everyone. Thank you. Have a nice day.